health issues. We broadcast live from Johannesburg in South Africa. You can also find Health Talk on our YouTube channel. I'm your host, Dr. Salome Daoum. Coming up on today's show is a discussion on some embarrassing health conditions. As a parent, you may be concerned about your daughter's excessive sweating problem that frequently embarrasses her to an extent that she refuses to socialize with her peers. Perhaps you just cannot stand your adolescent son's smelly feet. Are you embarrassed by your work colleague who has a problem of bad breath and can't find that nice way to offer some advice? Do you find yourself dozing off from time to time during the day because you simply cannot sleep peacefully at night due to your partner's loud snoring throughout the night? Well, stay tuned because we will, during this show, unpack all these embarrassing issues. We have 3 experts, a dermatologist and 2 dentists, who will help us understand what these conditions are and how best to deal with them. We also have a couple who will share with us their experience with the problem of snoring. But before that, though, we look at current health stories making headlines. Now, as the Ebola crisis deepens and the death toll now having surpassed the 4,000 mark, there are more calls for a stronger and more coordinated international response. While no cases of Ebola have been reported in South Africa, the country is ready for a possible outbreak. Health Minister Dr. Aaron Motsoaledi said this on Friday. Take a look at this insight produced by Wandile Mufokeng.
According to the latest toll from the World Health Organization, the deadly virus has killed more than 3,400 people in West Africa since the beginning of the year. Recently, South Africa has set up a fund to mobilize resources from government, businesses and the general public. The aim is to help fight the outbreak of the disease in West Africa. Although there have been few false alarms in South Africa, thanks to high-tech early detection mechanism and highly skilled laboratory staff. There is to date no confirmed cases of Ebola in South Africa. Meanwhile, following a cabinet briefing in August, the South African Health Minister Dr. Aaron Motsoaledi announced that government has accepted the SADC's decision that South Africa be the center of excellence for Ebola training, laboratory diagnosis and clinical expertise. High-level deliberation on the Ebola outbreak that has gripped West Africa took place in Kempton Park, Johannesburg on Friday. The minister went on to insist that the selected hospitals have received guidelines on viral hemorrhagic fever and Ebola viruses.
Port health services, public and private healthcare practitioners were also put on alert. We also strengthened port health, the ports of entry, especially OR Tambo International Airport and Lanseria, because we expect that if there's going to be entry in South Africa, the likelihood is that it will be through the 2 airports. But we are also strengthening our surveillance, Cape Town International Airport and Kinshasa. But our biggest concentration of forces and person power is OR Tambo and Lanseria.
Dealing with all aspects of diagnosis, isolation, treatment and even management of possible fatalities that may occur as a result of the Ebola virus. At this stage, the National Department of Health in South Africa has not confirmed whether the country is indeed expecting any samples for testing Zimbabwe following reports of a Congolese student admitted for hemorrhagic fever symptoms in Harare. Meanwhile, Doctors Without Borders say the world must act now against the Ebola outbreak in West Africa to prevent the disease from spreading. A Ugandan man presenting all symptoms of hemorrhagic fever died in hospital in the Ugandan capital Kampala on the 4th of October. The Center for Disease Control and Prevention (CDC) confirmed that the man's blood test has revealed it was Marburg fever. Marburg hemorrhagic fever is an acute infectious viral disease with similar symptoms to those of Ebola.
For a discussion on Ebola, we joined in our Johannesburg studio by Professor Shabir Madi, who is Executive Director of the NICD, or National Institute for Communicable Diseases, which is a division of the NHLS, or National Health Laboratory Service. Professor Madi, welcome to Health Talk.
Thank you. Good morning.
Right. We've seen in the inset about this deepening crisis.
Right.
We've heard calls for international responses. A couple of days ago, we saw U.S. troops, settling into the West Africa region. Firstly, your comment on the international response now. A little too late, do you think?
Well, it's never too late.
Yeah.
It's certainly been delayed, but it's never too late. I think if nothing had been done now, the situation in 6 months from now will be much bleaker than what it is going to be.
Yeah.
So with a great mobilization that we've seen at the international front, I think for the first time we are in a position where we're able to now do the type of interventions that are actually required to start bringing this epidemic under control. It has been delayed. This is something that should have probably taken place already in March, April, when the first cluster of cases came through. But it's taken the international community some time to mobilize, but they've come to the fore now. And now they're coming to the fore. They're coming to the fore with numbers, both in terms of assistance with military personnel, who are important in terms of ensuring security in those areas, including security for healthcare workers. And they've also come to the fore in terms of the amount of money that's required to set up treatment facilities. They've come to the fore. A number of countries are coming to the fore in terms of healthcare personnel, and epidemiologists, which is really, really what's required and has been lacking up until now to contain this epidemic.
Mm-hmm. Well, some people criticize the international community that, the reason there's been this delay is that it took some international, visitors, being infected and actually, succumbing to the illness before they were, kicked into action. But anyway, let's leave that. I mean, at least it's happening.
Right.
We heard that here at home, there was this press conference that our health minister held yesterday to talk briefly about, our role as South Africa in the West African region. Do you perhaps just want to take us through what role actually South Africa is playing in that region?
Okay. So South Africa, in fact, up to at this stage, besides for Uganda, is the only other African country that's actually lending support to those Western African affected countries. And what we have done is that we've basically lended support in the place where we probably have got a most expertise when it comes to managing this sort of an outbreak, and that is laboratory testing.
Right.
So at the National Institute for Communicable Diseases, we've got an expert team that's able to deal with Ebola. So South Africa, as an example, is the only country on the entire continent which has got what we refer to as a BSL-4 facility. Mm-hmm. It's a high-level facility in which you can basically deal with these very contagious organisms.
Right.
Now, that facility has been ongoing for the past 3 to 4 years, and they were able to actually mobilize themselves and actually deploy a mobile laboratory testing facility to Sierra Leone to actually assist with testing. Now, this is critical to being able to impact on epidemic, because unless you know who is actually infected, you're simply not able to do anything else. You're not able to treat the appropriate persons, you're not able to do contact tracing, you're not able to quantify whether the epidemic is actually increasing, decreasing, or what's happening.
Yeah.
So the actual testing of individuals that are suspected of having Ebola is critical to any sort of a response to the epidemic, and that's where South Africa has really come to the fore. At this point in time, we've already established a presence in Sierra Leone. We had one laboratory team that rotated there for about 5 to 6 weeks. We've now sent a second laboratory team to relieve the first one, and the plan is to basically allow us to actually train the local Sierra Leoneans that come the end of December, we would be able to hand over this laboratory to them to be able to do the testing themselves.
Mm-hmm. What about from, with the source of the infection? I mean, I hear about the testing. Right. Do we know exactly, what the actual source is? Because I guess that's important as well, isn't it?
Sure. So we understand that the source of the infection is usually a sort of a transmission from animals, wild animals, bats, primate, non-human primates, deers, etc., to humans.
Right.
So the natural reservoir is usually the bats, the fruit bats.
Okay.
Now, what's actually happening in these sort of countries, and fortunately that sort of cultures don't exist in South Africa, that it's not uncommon for people in the West African countries to actually eat bats and to actually handle dead carcasses of wild animals. And it's that handling of dead carcasses of wild animals as well as the eating of bats which allows the virus to actually escape the species barrier. Yeah. So the virus doesn't naturally infect humans, but it escapes the species barrier by actually coming into contact with these dead carcasses or these bats which are undercooked. Yeah. And that's how the virus actually enters into the body. Okay. Now, once it enters into the body, what happens is it takes between 2 to up to 21 days, usually about 2 to 5 days for the person to actually become sick from the time they've been exposed to the virus. When a person becomes sick, that's when we really face a problem, because at that point in time what happens is that they can be person to person transmission of the virus. It's not airborne, it's with direct contact of bodily samples, bodily fluids, and that's when the transmission starts to take place.
All right. I mean, just lastly, we've run out of time. In South Africa now, we don't have any reported cases of Ebola. Your message to South Africans out there?
We've got absolutely no reported cases in Ebola. We've basically got a number of capabilities that have been put into place by the Department of Health, by the NICD, by a range of doctors that work in the public sector. A number of initiatives have been put in place to ensure that even were a case of Ebola to come into the country, and it might, were a case of Ebola to come into the country, South Africa will be adequately equipped in terms of being able to contain it and prevent any sort of an outbreak, and nothing to the scale that we're actually seeing in West Africa.
Okay, so no need for us to panic at all.
None at all.
Well, I'm afraid that's where we're going to have to leave it because we've run out of time. Okay, and thank you very much. And that was Professor Shabir Badi, Executive Director of the NICD. Now, a report published by Amnesty International has revealed that hundreds of pregnant women and girls are dying in South Africa simply because of fear that their HIV status may be revealed when they access antenatal care services. The report was released in Johannesburg this week by the Secretary General of Amnesty International, Salil Shetty.
Pregnancy, a mother's gift to mankind. The first 12 weeks is critical, but for many it can be traumatic. Annually, a staggering 1,500 pregnant women and girls die as a result of the following causes. Testing for HIV was compulsory. Rights of confidentiality and privacy were violated by healthcare workers. There were separate queues for accessing ARVs. There's apathy around sexual and reproductive health and rights. This increases unplanned pregnancy and HIV transmission. Coupled with this, poor road infrastructure and persistent shortages of public transport to access clinics.
If you're poor, if you're rural, if you're a woman, if you're HIV positive, the chances are that you're not going to get the services, and the chances are there's going to be complications during pregnancy and childbirth.
The report recommends extended child support grants to include pregnancy.
That they consider extending the system of child support grants to include the period of pregnancy, to enable women and girls to afford the transport costs to the clinics, but also to allow them to cope better with the other increased financial pressures during their time of pregnancy.
South Africa is unlikely to meet its Millennium Development Goals of reducing maternal deaths by next year. Gillian Pillay, SABC News.
Okay, now on to our main topic for today. Sweating is a normal and important mechanism that helps us regulate our body temperature. However, when sweating becomes excessive beyond what would normally, would be expected, it is referred to as hyperhidrosis. Here's a big term, but anyway. Now, this condition can be a major source of stress and embarrassment. Take a look at this insert produced by Tamim Bogan.
Many people experience excessive sweating, especially in summer. To many, air conditioners are a relief. The scorching hot sun can make a walk or a workout a painful experience if one sweats excessively. Excessive sweating in public may cause embarrassment, and some people don't like it. For some, too much sweating will not only interfere with their daily routines, but sabotage socializing and professional interactions. It begins during adolescence, and if not stopped, may go on forever. Most sweating happens in the face, hands, underarm, and feet. This may result in smelly feet. In some cases, odor-causing bacteria creates a foul smell that creates a stigma. Some people just sweat excessively with no associated bad smell. Why does it happen? Experts unsure, but there's some evidence that it could run in families. Extreme stress and anxiety disorders can cause excessive sweating. Other illnesses such as obesity, diabetes, and high blood pressure may cause sweating. Withdrawal from many legal and illegal substances, including alcohol, can sometimes be accompanied by a prolonged sweating. While excessive sweating isn't medically dangerous, it can cause significant emotional and psychological distress. There is a way out. Effective treatment is available. Excessive sweating can be a symptom of something serious going on in your body. It is better to get expert advice on the cause of excessive sweating, rather than try to deal with it yourself. However, living a healthy lifestyle and engaging in enjoyable physical activities can make you feel more self-confident.
All right, to help us understand the subject better, we're joined by an expert in studio, Dr. Hitesh Pitamba, who's a specialist dermatologist in private practice in Johannesburg. Dr. Pitamba, welcome to Health Talk.
Thank you so much for having me.
Right, I mean, we all sweat. Maybe before we begin the subject of excessive sweating, can you just take us through why do we need to sweat?
Well, it's basically to maintain the homeostasis of your body, the balance.
Yeah.
Also to release some of the toxins that you metabolize or break down. So it's basically to maintain your homeostasis, meaning the equilibrium of your body temperature as well.
Okay. Now, we obviously we're talking about excessive sweating. Now, when is sweating too excessive? I mean, how do you differentiate between what is normal sweat? I mean, if you go out for a workout, you sweat a bit.
Exactly.
I mean, it's expected that you sweat.
So, it's relatively speaking. For example, excessive sweating will be a lot of sweat without any emotional or physical stimuli. So, a normal person will exercise a lot or have a lot of stress or emotions, and that will cause sweating. But without that emotional or physical stimuli and you sweat, then that would be excessive because you don't have any stimulus for sweating. It's just a natural, spontaneous, excessive sweat.
Okay. So there are these people, obviously, who sweat excessively.
Absolutely. Without
where is it common? I mean, this whole problem of excessive sweating. Is it certain individuals, certain ages?
No, it's all race groups, both sexes, and we've seen it namely under the armpits, palms, and soles more frequently. And that's often of social barriers and stigmata that they come to you for management.
Yeah. So what causes this problem of excessive sweating?
Well, it's difficult to ascertain. Sometimes it could be a genetic predisposition. In some people have an autosomal dominant predisposition. Sometimes it could be an underlying secondary cause where they have an underlying metabolic condition such as a thyroid problem or high blood pressure, as he mentioned in his insert, or he could have had, depending on his diet, maybe had excessive alcohol. So it depends on the underlying physiological problems, and you have to go a lot into the history taking of the patient. Is he on any medication that causes him to sweat excessively? So that's also of paramount importance. So the history is very important, not to just label a person that, oh, you just got a sweating problem. Maybe he's got underlying adrenal gland tumor, like a pheochromocytoma. So it depends on the type of sweating he has, whether it's localized or generalized, whether it's just palms and soles, and that will guide you as to, in your history taking, to ascertain the type of hyperhidrosis the patient has.
All right. That big term again, hyperhidrosis, okay, which means excessive sweating.
Hyper means excessive.
Right. I mean, this obviously has some impact, on the person that suffers from hyperhidrosis or excessive sweating, especially in young people. I mean, and it's perhaps associated with body odor.
Sometimes it may be associated, we call it bromhidrosis.
Right.
And it has a malodorous smell to it, so patients often feel that their sweat has a terrible odor. And often bromhidrosis per se can be also a psychological problem, because a lot of times patients come to me with bromhidrosis and you smell they sweat and they don't have a problem, so they have a psychological problem themselves. Usually through bromhidrosis, the patients themselves don't even recognize that they have bad body odor.
All right, we'll come back to bad body odor. But just talking about the impact that this excessive sweat has on people, I mean, it can be quite major. Are there any? I know we've spoken a bit about causes, medication, underlying diseases, and so on. But let's talk about general things. Yes, you mentioned alcohol. Any foods that perhaps may exacerbate this problem?
Caffeine, hot drinks, spicy foods, chili, as we know, and that's what we call gustatory hyperhidrosis, where on stimulation of your sympathetic supply as you ingest food, causes you to sweat.
Okay. How can this problem be prevented? I mean, clearly, obviously, when there's underlying diseases, I would imagine those would be treated. But now, let's talk about giving advice to someone out there who has this problem of excessive sweating, who is embarrassed by some of these. Are there simple things that people can do to try and,
Sure. Obviously, first of all, you start with topical treatment where you use aluminium hydroxide, often seen in our antiperspirants.
Yeah.
We can use those topically. Sometimes it depends on the type of sweating problem, whether it's axillary or palmar and plantar,
Yeah.
which is of the palms and soles.
Well, antiperspirants, and
Yeah.
they only put in the axillary?
Armpits, yeah, so nowadays they got in the new ones where the aluminium hydroxide concentration is much higher.
Yeah.
Obviously, you run the risk of irritation, secondary contact dermatitis, where because of the chemicals it can cause irritation of the skin.
Yeah.
So
Okay.
often
Let's just, sorry to interrupt. I just want us to put it into perspective for our viewers.
Yeah.
That we're talking about antiperspirants
yeah,
that contain aluminum hydroxide.
yeah, or
You know,
any aluminium compound.
or any aluminum compound that they can use in the armpits
But,
or in the palms.
topically on the palms. Yeah.
All right. But how will they know that this is the right sort of antiperspirant?
Well, I think at the pharmacist they should or speak to the dermatologist as to what compound they should use, and they'll be advised accordingly. Also, like at my Baragwana days, we should use 10% formaldehyde solution,
Yeah.
where you soak your palms and soles for 10 minutes in 10% formaldehyde,
Right.
and that also has an anti-perspirant effect. However, you run the risk of an irritant contact dermatitis. But all these products, because they are so highly irritant, you should be aware of that. And also you can use drying powders with a lot of tannins in it, or the salicylic acid, and to absorb the sweat. So powdering is also an important topical adjunct in your management.
I see. But I mean, obviously some of these can only be, you can only
Yeah,
get them if you visit a doctor.
And
What
then-
about perfumed antiperspirants or deodorants?
Yeah, absolutely. Once again, you will look for the ingredients within that, and your dermatologist or pharmacist would advise you accordingly. And then obviously, if a lot of patients of mine are not responsive to antiperspirants per se, and then we have another treatment modality called iontophoresis, and then we also have another treatment modality called Botox, where we inject.
So even Botox as well?
Yeah, for axillary hyperhidrosis. So we inject the sweaty area with Botox, which inhibits the production of sweat in that area.
Yeah.
And then last but not least, we have a surgical modality where we destroy the sweat glands by surgical method.
Sure, we don't want to get to that point. Yeah. All right, let's just break it up. We're going for a break, and after the discussion, we focus, after the break rather, we focus our discussion on body odors. Stay with us.
Thanks, Mom. Have fun. You too.
You're watching us on SABC News on DSTV channel 404. Welcome back. Now, we're still with Dr. Hitesh Pitamba, and we're now discussing body odors, or something called bromhidrosis or something like that. Okay. Maybe let's just talk about it. What determines body odor? I mean, we all have some sort of body odor of sorts. Yeah.
So basically, it's the apocrine glands, and these are glands that are found under the armpits and around the pubic area. And what happens here, as you produce sweat, the normal bacteria in your skin reacts with that sweat and produces special fatty acid esters, and those give off that smell, especially around adolescence or puberty.
Yeah.
And a lot of time in true bromhidrosis, as I alluded to earlier, the patient himself doesn't know that he has the bad odor. Often it's the parents or the sister or someone around him that will pick it up. That's in true bromhidrosis. And then you have the other type where the patient himself believes that he has this bad odor, but when you examine the patient, he does not have it. So often it's a psychological problem for the patient himself, and often will need that type of treatment where he's dealt with psychologically. And that's also a condition to keep in mind. And then sometimes you have olfactory tumors, so like growths in your olfactory areas, they can produce this type of bad odor. So that's something very rare.
That's in the mouth now.
Yeah.
Yeah.
So it's something very rare, and that's something to consider in some cases. Often it's a very tough condition to manage. And basically you have to also minimize the sweating if they have true bronchidrosis. And so you manage the same way as you do with hyperhidrosis.
But why is it that there are certain areas that tend to be, if I can call it that, a little more smelly than others? Like because the armpits, the groin and the feet?
That's because the glands are different. You see, so you have apocrine glands. And these glands, the fatty acids that are produced in the apocrine glands, they produce a different type of a sweat compared to the eccrine glands, which are your normal sweaty glands. So the apocrine glands have more a different structure to the eccrine glands, and therefore the odor is different. And apocrine glands are typically concentrated around the armpits, the groins, and the pubic area.
Okay. So what then happens? I mean, when you sweat normally, you wouldn't smell.
Exactly.
What is it that results in that?
Yeah, so
smell?
certain individuals, they produce a special bacteria on their skin, and that reacts with the sweat from the apocrine glands. And that reaction of the bacteria with the sweat causes the release of these fatty acids, and they produce the odor.
All right. So in these people then, I would imagine you're saying that, I mean, there are people who have this excessive sweating with body odor. What sort of people are those? Are there any gender differences? Is there any perhaps age differences?
Sometimes it's around puberty, they pick it up, or young children. Very rarely we see it at a later age group, and often those are the ones with the psychological problems where maybe someone brought it up to them and it sticks into their mind that they really do have bad body odor. And often when we examine the patient or smell their body odor, which is not a pleasant thing to do, but we have to do it, and you often don't get the smell. So often it's their inherent feeling that they feel that they have this bad body odor, and usually they don't. So it becomes a psychological problem.
Yeah. All right. Let's talk now about understanding a little bit about some of the causes. And if I understand you correctly, you're saying that oftentimes it's these simple things like you're sweating too much and the local bacteria and so on, but there may be underlying diseases.
Yes, for hyperhidrosis.
Okay. Let's talk about how these are managed now. Somebody comes to your room, says, look, I have this problem that, every time, 2 hours after, washing, walk to work, people tell me I just smell around my armpits.
Yeah.
Your advice to a person like that?
Yeah, so basically you want to find out why is he sweating so much and why is the body odor so much. So you'll often have to go into his diet, because certain diets high in garlic or certain spices can produce that type of odor as well. And also whether he's cleansing himself properly, using the adequate cleansing materials or lotions or bars. So that should also be gone. His generalized hygiene should be also examined.
Yeah.
So there's a whole lot of factors.
Why do people who are overweight, tend to have this problem of, bad body odor?
I think probably not always, but if they are predisposed to it, it's because they have much more folds, so they lock in the moisture much more than a slim individual.
Okay.
So possibly that's the reason, and they entrap the bacteria and the sweat more.
Okay. And what sort of simple things can people then do at home to avoid this problem of, bad body odor?
Well, often good hygiene, normal cleansing methods, maybe more frequently, good antibacterial soaps, a good antiperspirant with the aluminium hydroxide, a bit of perfume in it to counteract it. Watch your diet.
So before we leave the soaps now, you're saying that there are specific types of soaps that people should be looking for.
Well,
not your ordinary soaps that you find in the
supermarket. You get specific types of soap with antibacterial properties in it, and that your dermatologist or your pharmacist would advise you accordingly.
Okay.
They are not always effective.
Right.
Often some people are just genetically predisposed to body odor, so they will just have it. But then you'll be also sometimes hormonal in females, where around puberty they produce about more hormones, and that stimulates your apocrine glands to produce more sweat, and that reacts. Often sometimes just putting on a contraceptive pill can sometimes also alleviate the problem. But it's very individually based, the management. So you have to go to your dermatologist. A proper history taking is of paramount importance, and every patient is treated, or the treatment is tailored according to the patient.
Okay. Talking now about foods, you mentioned spicy foods. You know, there's this notion that if you eat spicy foods, and especially acha,
Yeah,
that,
because
you know, it results in some smell around the armpit.
yeah, absolutely.
Why is that? Is it
It's just
because
the
oftentimes
metabolism.
it's not associated with a lot of sweating?
Yeah, but it seems that your body breaks down the specific spices,
Yeah.
and that gets secreted into your apocrine glands. Like I mentioned earlier, we sweat to release certain toxins and certain breakdown products in our body. And certain spices like, as in, we call it methi or something like in achar,
Yeah.
it's broken down, as well as garlic is another example.
All right, okay. So,
There's quite and onions as well.
all right. So basically, maintain just, you know, keep
Balanced
yourself
diet,
clean.
drink lots
and then-
of water.
Yeah.
Yeah.
All right. Well, I'm afraid we're going to have to leave it there because
Yeah.
that's all the time we've had for. And thank you very much for your
Sure.
contribution, Dr.
Thank you.
Hitesh Pitamba, dermatologist in private practice in Johannesburg. Now, you want to know more about halitosis and how to manage it? Stay with us because that's coming up after the break.
Do you think that the media has then fully unpacked of what these strikes could possibly do to the economy if it's going to that extent of a recession?
It doesn't mean that when we solve the mining strike that suddenly the GDP is going to go and increase and we're all going to go and have an economic
Very
boom.
true,
So
yes.
we've got to go and look at that fact as well.
Obviously, the media, can't touch on absolutely everything. It is a very complicated situation.
Watch Media Monitor with me, Alicia Jali, Sundays at 9 a.m. only on the SABC News Channel.
If you just tuned in, this is Health Talk on SABC News. Now, if you're constantly popping mints or chewing gum to cover up that bad breath, you're not alone. 1 in 4 people has bad breath. Known as halitosis, bad breath can strike periodically or persistently depending on the cause. Take a look at this insight produced by Tando Ngumalo.
If you don't brush and floss your teeth after every meal, bits of food that get stuck in your teeth and gums and your tongue will begin to decay and emit foul odors. An unclean mouth also means that bacteria can grow, potentially leading to gum disease, which is also one of the causes of bad breath. In addition, certain foods and drinks are more likely to cause bad breath, including garlic, onions, cheese, orange juice, and soda, including diet varieties. Starvation or intense dieting can result in bad breath. In some cases, other problems beyond the mouth can cause bad breath. For example, fruity breath may be a sign of uncontrolled diabetes. A urine-like smell, especially in a person who is at high risk of kidney disease, can sometimes indicate kidney failure. So it is possible that bad breath may be a result of a lung infection, diabetes, kidney or liver disease. These conditions can only be diagnosed by a health professional. Bad breath caused by dental problems can be easily prevented. Daily maintenance calls for brushing your teeth, tongue and gums after meals, flossing and rinsing with mouthwashes. Regular visits to the dentist at least twice a year are advised to ensure optimum oral health. Bad breath can also be combated by drinking plenty of water every day, as this encourages saliva production, which loosens food particles. Other products that keep breath fresh and prevent plaque from forming include sugar-free gum, sugarless lozenges, raw carrots, and celery. The treatment of bad breath depends on its cause. It's always better to prevent the problem of bad breath by maintaining proper oral hygiene. If despite proper hygiene you have bad breath, always consult your dentist or doctor to exclude other causes beyond the mouth.
Okay, to enlighten us a little more now on this problem, we're joined in studio by Dr. Komotso Sepeng, who is a dentist from Butzilu Hospital in Soshanguve in Pretoria. Dr. Sepeng, welcome to Health Talk.
Thank you for having me.
This can be quite a bad problem. You know, I mean, people are often a lot embarrassed. Sometimes it's not the people that have bad breath, in fact, that are embarrassed, but those around them. What causes this problem?
Halitosis is bad breath. It could be caused from inside the mouth. It's gum disease. Most people don't brush their tongue, and there's bacteria that is in the mouth, and then with protein from the food and everything that we're eating, the bacteria produces sulfur gases, which are very foul smelling.
Yeah. So it's not the food itself, but it is the action of the bacteria on the food in the mouth.
Yes.
Okay. So will I be correct in saying that in the majority of cases, bad breath originates from within the mouth?
Yeah, I think we could say the majority of bad breath is from the mouth. So the best way to go about is to see a dentist if you think that you do have bad breath, so that they can rule out all the causes from within the mouth. Then if we don't see the cause in the mouth, then we can go to other areas of the body.
Okay. This is quite a common problem. Is it a problem that cuts across the ages, all different types of people?
Bad breath is common in very young children. And then the most common cause is children of that age have tonsillitis, they've got adenoids, they breathe through their nose. So when there's not enough saliva in the mouth, bad breath will occur. Then other age groups is in the older ages, where the saliva production has decreased over the years, especially when they're taking lots of medication, which also affects the flow of saliva. So I would say in those age groups, it's common.
Is it possible that it could be because of a problem not in the mouth, perhaps somewhere else?
Yes, the other causes would be from, like I said, the tonsils, the adenoids, or if people have sinus problems, and then it could also be from the lungs and from the stomach, the GIT.
All right. Okay. All right. Well, it's quite a problem now. Maybe let's start talking about how this can be prevented now.
Okay. Bad breath can be prevented by obviously brushing twice a day regularly, flossing at night, because between the gums, that's where this bacteria is going to stay, because there's not oxygen in that area. Also brushing our tongue, scraping our tongue to remove all the bacteria on the tongue. It's what we can do to prevent it. And then also there's a mouthwash that you can use which has chlorhexidine dioxide, which is antibacterial. Yeah. If a mouthwash does not have that, it will just mask the problem for that time.
Okay.
It doesn't have active ingredients.
I just want us to get back to that one thing. I mean, we say that people should always brush their teeth, on a regular basis. So you're saying, actually, not just the teeth, but the tongue as well.
Yes.
So everybody should be brushing their tongue. What part of the tongue?
More especially the back of the tongue, but obviously it can be a bit uncomfortable. So you just need to stroke your tongue at least once or twice just to remove that bacteria. You don't have to vigorously brush your tongue.
Right. What type of toothbrush? There's different types. You walk into the supermarket, you see a toothbrush that's hard, the other one it's soft. Which one would be preferable?
We always prefer a soft to medium brush so that it doesn't hurt your gums when you are brushing.
Right.
And now I always advise my patients that they must just go for a simple brush.
Right.
These complicated brushes, you must use them correctly. So if you don't use them correctly, they do more damage than good. So just go for as plain as you can get.
Right. Toothpaste?
It's a matter of choice. If we want to give you something specific for a specific problem, then we can tell you that you must use this a specific toothpaste, but it's your personal preference.
Okay. And then what about flossing now?
Yeah, we should floss at least. I usually recommend flossing at night so that all that you've consumed during the day you can have time, and then you floss properly in between your teeth. There are bad flosses out there, so you must get a floss that's not too thin, that's not going to cut your gums, because that can also cause problems. So you must get a decent one. I think the cheaper they are, the more damage they do. So
well, that's not very positive. The cheaper they are, the bad they are.
Yeah,
so
obviously you need a
more.
good quality floss so that it does. Because people don't like to floss because they say it cuts their gums. So I realize that is because of some of the flosses, they are quite thin. So you need a floss that is that will spread out as you are flossing.
Right.
So it needs to be a certain quality.
What about toothpicks?
We don't recommend toothpicks at all, because as you peek into between the teeth. You actually can dislodge those, whatever you want to take out, more into that space between your teeth, and then it gets stuck there, and then the bacteria is going to produce more of that volatile smelling sulfur products.
Some people even use not just toothpicks, but needles and pins and all sorts of things too. So you don't recommend that as well?
Not at all, yeah.
All right. Let's talk about the food now. What type of food should be avoided to prevent this problem of bad breath?
Okay, the food that produce a lot of bad breath is obviously the onions, the garlics. So if you do like them, I would say you should know that you must maybe brush your teeth thereafter. I wouldn't say people shouldn't eat them if they enjoy them, but then you must know that you must double your efforts thereafter.
Mm-hmm. What about sugary drinks and sugary foods that contain, high amounts of sugar?
I wouldn't say they would cause bad breath per se, but whatever is in the mouth there, where the bacteria can produce foul smell. So it's not specific that the sugary things, but obviously they will cause decay in the mouth.
Okay, because we're told that bacteria thrive on sugary stuff.
Mm.
All right. Okay. Now, talking about food and brushing the teeth, there's this notion that people shouldn't brush teeth immediately after eating. Why is that? Some people would say, wait at least about an hour or two, then brush your teeth. Any reason, or can people just brush their teeth anytime?
No, I think you can just brush anytime.
Okay.
Mm.
So the idea is to make sure that after eating, just make sure that there's nothing that stays in between the teeth.
Yeah, so that the bacteria will eat on that what is left in the mouth. Yeah.
All right. Well, looks like the most important message here is oral health, because it can prevent quite a lot of issues.
Yeah, and obviously also drinking lots of water, because as you drink water, it cleans the mouth.
All right. Okay. Well, there we're going to have to leave it.
Okay.
We've run out of time, unfortunately, and thank you so much for your contribution. That was Dr. Komotso Sepeng from Bichilo Hospital in Socialze in Pretoria. Now, when we return, we'll look at the problem of snoring. Please don't go anywhere.
We've seen the last of you in politics.
I don't know. No, I'm just okay now with the work that I'm doing. Let me just do one thing at a time. So I don't have any plans for politics.
Watch Question Time with me, Mpho Tsedu, Monday to Thursday at 5:30 p.m. on the SABC News Channel.
Zoom into Africa. This is Ghana. The president is Mr. John Dramani Mahama. Ghana got independent from the United Kingdom on 6 March in 1957. The population is more than 25 million people. One of Ghana's major languages spoken is English. Monetary unit is cedi.
Welcome back. Now, someone once wrote, laugh and the world laughs with you. Snore and you sleep alone. And went on to write, life is what you make of it. If you snooze, you lose. And if you snore, you lose even more. Although not taken seriously by many, snoring is said to be the largest social disease in the world. Take a look at this insert produced by Wandile Mufukeng.
When you doze into a deep sleep, the tissues in your throat relax. Sometimes when tissues relax, they may partially block your airways, causing them to vibrate. The resultant sound produced is what we refer to as snoring. A low, thick, soft palate can narrow your airwaves, obstruct airflow, and increase vibration. Drinking too much alcohol before bedtime can increase your risk of snoring. Other causes of snoring are a nasal congestion as well as a crooked partition between your nostrils. Fat people who have a low, thick, soft palate are at risk. Throat tissues can block the airways, thus preventing you from breathing. Sleep apnea is another condition associated with snoring. Snoring has various symptoms such as noise during sleep, excessive and daytime sleeping, difficulty concentrating, a sore throat, restless sleep, gasping and choking at night, chest pains at night. Snoring can cause discordant and disturbing sounds. Partners get affected by snoring. Sometimes breathing can stop, resulting in a period of silence. Snoring can be frustrating and can cause daytime sleepiness, anger, difficulty concentrating, risk of blood pressure, aggression, learning problems, and disruption of bed partner sleep.
Now, to help us understand this problem of snoring even better, we joined in studio by Dr. Dave Cotton, who's a dentist from the Snore and Sleep Apnea Center in Rosebank. And we have Mr. John Fourie, who's going to share his personal experience with this problem of snoring. Gentlemen, welcome to Health Talk.
Thank you.
We've seen that this is a major problem. I mean, it can cause huge embarrassment, not perhaps to the person that's a snorer, but to those around them. Now, in a nutshell, what sort of people snore?
Anyone can snore. You get a child snoring. That's usually due to the adenoids and tonsils being enlarged. But children do have sleep apnea as well, and parents should recognize this.
Yeah, we'll come back to sleep apnea because that's a concept I want us to unpack. Now, in adults?
In adults, anyone can snore. Thin, fat, doesn't really matter. The obese people usually snore more.
All right.
What happens is snoring is mainly in REM sleep, REM sleep, rapid eye movement sleep, whatever you want to call it. That is your fifth stage of sleep. In that stage of sleep, all your muscles in your body are relaxed except two. Your diaphragm, which is helping you breathe, and your eyes, which are rapidly going across like that. So your eye muscles are working and your diaphragm is working. You will get a twitch of a toe or something like that. That's not important. Okay, so now in that stage of sleep, your tongue, which is a huge muscle and is attached to the lower jaw, also relaxes. Now the lower jaw relaxes as well because it's got big muscles, the masseter, the temporalis, and pterygoid muscles inside, and all these muscles relax. And when they relax, your tongue and your lower jaw falls back. Because the tongue is attached to the lower jaw, it falls back with the lower jaw. This creates a problem because tongues come in various sizes, small, medium, and large. And in a snoring person, there's always a large tongue. And in a snoring person, the palate is always large as well. It drops down below the root of the tongue. Now, depending on where that is, you get your sleep apnea and your snoring. So snoring is actually obstructive. And sleep apnea, the most common, is obstructive sleep apnea.
So what is the association then between snoring and sleep apnea? Does it necessarily mean that everybody that snores has sleep apnea or the other way around?
No. Severe snorers. Snoring is the first indication of sleep apnea. Now, sleep apnea also comes in various types. You get mild, moderate, and severe. And you get a moderately severe and mildly severe, mildly moderate. So that's what comes about. Is what happens is that when you're snoring, you get the vibration from your throat. You get the vibration from the muscles, from the soft palate, the uvula, and the tonsillar area. That vibrates, and that gives you your snoring noise. And anyone can do it themselves. They can go, and they can feel the vibrations at the back of the throat. So it's not from the nose. It's not from the deviated septum. It's not from the sinuses. It comes from the throat.
All right. Mr. Fourie, we've seen how embarrassing this problem can be. And we want to, by the way, commend you and thank you very much for being brave enough to come share your story with us.
Because it's changed my life, and that's why I'm here.
All right. Well, tell us about it.
And I just don't know why the people out there on seeing people like this and getting it treated. I mean, it was like that, and my problem was solved.
All right. Tell us about it before you got treatment. What actually happened?
No, it was my wife's problem. It wasn't my problem. Now at least we sleep in the same room again.
Right. Okay. So you there was a time when you couldn't sleep in the same room.
Well, she couldn't sleep with me because I was snoring too much.
Right.
But for me, it's not the snoring because I'm the snorer.
Right.
So I don't know I'm snoring. But what has changed, and that's why I'm here, is that I have a uninterrupted sleep now, and I'm much more refreshed in the morning.
Right.
And that, to me, has been a big impact on my life.
Right.
Is that I'm strong in the morning, in the mornings now.
And your wife can now
and she's happy
get
as
through
well.
the day. Normally,
Yeah,
she doesn't
now,
doze off during the day.
She's happy.
Great stuff. And you got help from Dr. Cotton.
Yeah.
Okay, Dr. Cotton, we've spoken about obviously the causes. We now understand what causes snoring. How do you normally approach the problem of snoring that presents at your clinic?
Well, patients always come to us with their problems. Some are severe, some are not severe, some are obese, some are not obese. Each one's treated individually. Firstly, they have to come in and they have to fill out special questionnaires. It's called an Epworth Sleep Scale. That will give us an indication of what's going on. Is there sleep apnea or not? How severe it is. Now, once I see those questions and assess those questions, I will then decide to send the patient for a sleep test or not.
Yeah, what's a sleep test? What do you do there?
Sleep test is a polysomnograph. And they attach these electrodes to you at night while you sleep, and it gives us a reading. It gives us the apnea-hypopnea index.
In simple terms now.
Apnea is when you stop breathing.
Right.
You'll often get a person coming in one of the questionnaires it also says, do you stop breathing during the night? And they say their wife or their husband says, I stop breathing.
Yeah. All right. We've got about a minute left. And then how do you then help such people?
Well, if they're mild to moderate, we then give them an appliance which looks like this, and they put it in at night.
Yeah.
And they take it out in the morning.
All right. What's it made of? I mean,
it's a plastic.
Plastic, yeah.
And these arms are interchangeable.
Yeah.
We can shorten them or lengthen them according to the case.
Right.
If the patient is severe,
right,
we'll give them a CPAP machine, which is a mask,
right,
and a generator which breathes for them.
Yeah.
But unfortunately, 40 to 50% of people are not compliant.
Yeah.
It's a wonderful machine, but they're not compliant.
Yeah. What is it supposed to do?
It breathes for you.
Right.
It breathes for you. Now today they're automatic, so they breathe for you.
All right. Let's talk about that gadget now. You're saying that it's designed according to the shape of the mouth, the shape of the teeth.
It's custom made for you.
All right. And what does it actually then do? Does it, depress?
Depending, if you look at this is forward. This is actually my unit, my own unit.
Right.
And this is forward. What it does, it brings your lower jaw forward. I said to you, the tongue and the lower jaw are attached.
Yeah.
So it automatically brings the tongue forward.
Right.
So it gives you a bigger airspace.
Right.
So you can breathe easier.
Yeah.
And more oxygen.
And snoring completely.
Stops your...
In a second. Is that what you got?
Fantastic.
Right. And you're happy with it?
I'm happy. It took me 2 days to get used to it.
Right. Sounds simple. The cost?
It's expensive because you've got a technician and all the materials come from Germany.
Right.
It's 5,500 Rand.
Right.
And that's the complete treatment and after treatment.
Right. Okay. Very interesting. I'm afraid there we're going to have to leave it because we've run out of time. That was Dr. Dave Cotton and Mr. Fourie. We say goodbye to these wonderful guests. And yes, thank you very much for your contribution. Now, when we return, we'll wrap our discussion and leave you with that take-home message on these embarrassing health issues. Don't go anywhere.
Zoom into Africa. This is Sierra Leone. The president is Mr. Ernest Bai Koroma. Sierra Leone got independent from the United Kingdom on 27 April in 1961. The population is more than 6 million people. One of the major languages spoken is English. Monetary unit is Leone.
The Mantanga Cultural Village is a large family homestead with 16 huts, each of them with its own specific purpose.
My responsibility, it is taking care of the family. As far as cleanliness is concerned, I have to make sure that I keep the home as clean as possible every morning when I wake up.
That's Kaleidoscope, Sundays 5:30 p.m. on SABC News.
The Kenyan actress is the first from her country to win an Academy Award. Her Best Actress Oscar win has inspired many in Kenya.
Nyong'o's victory has made the headlines in all of the country's newspapers. This was Nyong'o's first role in a film after she had completed postgraduate studies in America.
Players in South Africa's music industry will attend the Music Exchange program in Cape Town, South Africa.
We as Africans, we have to embrace what is unique about us and about our music.
That's Afro Showbiz News, Saturdays 7:30 p.m. on SABC News.
Welcome back. So just to recap then, excessive sweating may be a sign of an underlying medical condition. Bad breath may also be a sign of underlying diseases not confined to the mouth. It is therefore important to consult your doctor or dentist for a definitive diagnosis and a suitable treatment plan based on the diagnosis. However, in many cases, bad body odor, including bad breath, is simply a result of local action by bacteria that produce that unpleasant smell. You can do simple things at home to save yourself some embarrassment. So wash regularly, especially on those very hot days. Use perfume-free antiperspirants. Brush your teeth regularly and floss, of course. Limit sugary and acidic foods and spicy foods and drinks. And if your partner tells you snore, it's not the end of the world. Consult your dentist to get some simple help. Well, we want to thank you very much for spending your time with us. You can watch Health Talk on our YouTube channel or catch a repeat of this show at 10 p.m. tonight. Please join us again next week, same time, for our next informative show. So have a great weekend and please do take care.